In a small village in Uganda, women sit in their huts, cooking on basic stoves stoked with wood. The smoke is a contributor to lung disease in a country where tuberculosis is rife. Many families across the world are exposed to smoke from a combination of indoor biomass fuel smoke, kerosene lighting, and tobacco smoke. Although people can receive treatment to recover from TB, many lives are destroyed by it.
Now what it does, it tends to destroy the lungs. So it destroys the lungs, and unfortunately after TB is treated, the destruction of the lungs doesn't reverse. So it stays, and when it stays, that will heal by scar formation. And among the so many things that will cause a chronic lung disease is the scar tissue that remains in the lungs. So that is now what will eventually bring the patients back, so that they will now require rehabilitation.
Experts suggest the situation can be reversed by the introduction of basic rehabilitation classes. A group of European doctors at a hospital in Kampala is studying Uganda's rehabilitation program for former TB patients.
Uganda is still among the 22 high TB burden countries in the world, ranked by the WHO. But the National TB program is doing a very good job in case identification and treatment. So in terms of burden, it is high, but the national program is actually controlling it. So then the thing that actually we worry about is these very high numbers of patients who have recovered from TB. So they're out there in the community, but then they start getting the complications of TB. So we are now likely to be facing very high numbers of patients with chronic lung disease.
The Kampala initial program will begin in May, but the pilot study has already been clinically shown to improve outcomes for patients.
I was too weak when I used medicine, it doesn't work. When I started exercises, I started getting that energy. But at that time when I came, I was too sick. When I got blood, much blood.
I had been admitted for 4 times, let me say. 2 to 4 times, what's on record, with tuberculosis, with pneumonia. But after these exercises, I've not been admitted again, and I feel better.
Patients in rural areas of Africa like Uganda are the most affected. They don't get the rehabilitation available in many wealthier countries, but the doctors in Kampala are convinced the scheme will improve the future of many more people if the study is rolled out elsewhere. Jane Keo, CCTV.